My name is Ty Brianna, and today I want to start by addressing a common belief that many people, including lawmakers, the media, and even the public, often assume. Most children enter the foster care system simply because their families are poor. This assumption can lead to misunderstanding and even the development of harmful policies. While poverty does create stress and challenges within a household, it doesn't automatically mean that a child is in danger of being harmed. Children who are placed into foster care are usually removed based on documented safety risk, not just a lack of income or financial resources. In this debate essay, I will argue that poverty alone is not the direct reason why children are removed from their homes. We need to look deeper than income and examine what truly puts children at risk. Instead, factors such as substance abuse, mental health issues, and lastly, neglect play a bigger role in why children enter the foster care system. In the state of Idaho, around 10.1% of residents are living in poverty, which is the lowest poverty rate in the entire country. Federal Reserve Bank of St. Louis, 2024. Despite this, approximately 2,606 children were served through the foster care system in fiscal year 2023, Idaho Voices for Children 2024. This number might seem high at first, but when you compare it to the total number of children in the state, it shows that most poor families do not have their children taken away. It highlights that not all families experiencing poverty are brought into the child welfare system. Child Protective Services cannot legally remove a child based on poverty alone. There must be credible and documented evidence of harm, neglect, and danger. The Federal Child Welfare Policy, under the Adoption and Safe Families Act, requires that efforts be made to preserve and keep families before removal occurs, especially when poverty is the underlying issue. This means the system recognizes that being poor does not necessarily equate to being unsafe. Through my research, it has shown that the most common reason children are placed into foster care systems are due to chronic neglect, parental substance abuse, untreated mental illness, exposure to domestic violence, not just financial hardship. According to the National Child Traumatic Stress Network, 2011, many children experience deep emotional trauma after being removed from their families, even in homes that may be unstable but not dangerous. This tells us that removal isn't a solution to poverty. It's a response to more serious risk. Some poor families never lose custody of their children, while some wealthy families do. It is not about the money, it's about the safety and well-being of the child. It is also important to note that systematic biases sometimes influences child welfare decisions. Families of color and low-income families are more likely to be reported to CPS, even when their situations mirror those of higher income white families. Social workers are trained professionals who evaluate the entire situation, not just the family's income. This includes examining parenting abilities, available support systems, home environment and safety, and emotional and mental health needs. Social work ethics encourages values such as dignity and the worth of the person, the importance of human relationships, integrity, and social justice. This means that instead of judging families who are struggling financially, social workers often focus on offering help, resources, and guidance. Fiscal Born, 2015. In many cases, social workers advocate for family preservation whenever it is safe and possible. They understand that removing a child is not always the first step. It can be traumatic and destabilizing. The real goal should be to support, not punish. Instead of damaging families by separating them due to poverty, we need to shift towards preservation care, and supportive services. This can include housing support, food access programs, childcare and early education, and lastly, access to affordable mental health care. For example, a parent might leave a child home alone, not because they're neglectful, but because they can't afford daycare and have no one to help. That's not abuse. That's the lack of support. In Idaho, there are recent efforts to expand the number of foster homes. But there's also a growing push to reinforce prevention partnership. Idaho Department of Health and Welfare, 2024. Additional training is being implemented to help child welfare professionals recognize the difference between true neglect and poverty-based hardships. By giving parents the tools to help they need to care for their children, we can keep more families together and reduce the need for foster placements. To wrap up, poverty alone does not directly lead to foster care placement. While poverty can increase the challenges that families face, most families living in poverty do not lose custody of their children. Instead, serious risk factors such as abuse, untreated mental illness, and neglect are usually present in child removal cases. Child welfare should focus on healing and helping, not just removing children from their homes. If we want to truly improve the system, we must work together to support and guide vulnerable families, reduce biases in reporting and intervention, and lastly, improve the systems that unfairly punish families just for being poor. In the end, every child deserves to be safe, but they also deserve the chance to grow up with their families whenever possible. Poverty should not be a punishment, and families in need should be met with resources, not removal. Thank you.
Hi everyone, my name is Lainey Devine, and for my part of this debate, I will be giving a differing view and discussing differing points of view, as my partner will be evaluating foster care and minutes on other strenuous components for the entering into the child welfare system. I will be discussing the means behind defending the fact that poverty does in fact increase a child's likeliness and chances of being brought into the child welfare system. In this child welfare system, sometimes sadly the systemic statistics claim that poverty is basically a crime, and is sadly often treated as one. Within the United States, children that live in poverty are more likely to be placed into the child foster care system. With that being said, according to the National Library of Medicine, foster care children have higher odds of living in poverty than other children, but that is entirely accounted for by their caregivers and their characteristic demographics. By Pack, Waldfolger, and Wyman. These issues highlight the troubling truth that poverty plays a strenuous role in post and previous foster care admittance. Neglect, in this case, referring to lack of food, water, and basic needs, is also intertwined with the term poverty. This can be a very middle ground topic, to say the least. However, this is where poverty can be easily labeled as the biggest component contributing to children being admitted into the foster care system. According to Adopt US Kids, a nationally known website for adoption, the most recent federal data, there are currently more than 400,000 children in the foster care system in the United States. They range in infants to all the way up to the ages of 21, depending on some state rules. The average age of a child in foster care system is more than 8 years old, and there are slightly more boys than girls. While these demographics might not matter, it goes into depth to show that children are often placed into foster care by being neglected, abused, and abandoned, whether that be at any age. The term neglect is where we reroute back to the point that neglect and poverty have become intertwined. Two different terms meaning the same thing in the systemic rule's eyes. With that being said, This leads to being punished by the states and punishing families by treating poverty as a crime and as considering neglect and refusing aiding and assisting these families. By a simple Google search, the term neglect means failing to care for properly, while the term poverty, on the other hand, means state of being extremely poor, lacking sufficient resources to meet basic needs like food, clothing, and water, and shelter. These two have become easily intertwined within our system, which supports the fact that poverty as itself, intertwined with neglect, has become the heaviest contributor to the why behind why hundreds of thousands of children are being admitted into the foster care system every year. Moving forward to the strains of living in poverty, the overall strains of living a life in poverty can lead to high stress levels, mental health issues, safety issues revolving around exposure to unsafe environments, and these components tie into the child welfare involvement in the first place. Living in poverty can look different for many people, but in similar cases that we hear of the most, working multiple jobs, house and home insecurities, insufficient funds, underfunded education, and community-based issues are all stemmed components of living in poverty. These underlying conditions can also lead to parental stress with and without children, increased mental health crises, and put families at increased risk for harm, instability, and child removal from the child welfare system. These issues also stem from the lack of resources and help to ensure increased child support through these situational issues. States and federal laws issue to take the children from these homes, increasing family trauma even when they are trying their best. Moreover, the flawed system heavily affects the communities of color on a deeper and more inclined scale. According to the National Bureau of Economic Research, the percentage of Black children involved in such investigations is nearly double the percentage of white children. Black children are also twice as likely as white children to spend more time in and of itself in the foster care system, by Leonardo Vasquez. This is also tied into communities of color being hyper-focused on by our flawed systemic system. This leads to child protective services cases, increased investigations, and leading to the taking and displacement of children into the foster care system, whether that be from lower income communities or anyone living in poverty. The overall racial disparity reflects the underlying disproportionate need for displacement and discrimination from child welfare investigators and the system as itself. The system can be biased against them and has systemically shown such case. This has also affected lower income communities more than any other community, hyper-focusing on the fact that poverty is the highest strenuous component overall. In conclusion, poverty is factually and undoubtedly known to increase and be the reasoning behind why children are being placed in the child welfare system on a day-to-day basis. The overall system itself equalizes poverty and neglect, which leads to more punishment rather than assistance. These families are often more punished by the loss of their children rather than gaining assistance through the states and federal laws. It also sweeps under the rug the underlying issues behind the system and why poverty is such a heavy contributor to the issue, while neglecting deeper social issues that put children at risk. Some do in fact speak on behalf that there are deeper and more rooted issues to contribute to the uprising increase of numbers of children being admitted into the child welfare system. However, although I can agree with many of these points, of these arguments, I believe strongly that poverty does in fact reign as the highest contributor to the why behind why children are being admitted into the child welfare system at a faster rate. and that is due to neglect and poverty being intertwined and the systemic flaws within our system without lack of aid and assistance. Thank you.